This is recording. Okay. Hey guys. So I'll start by introducing myself. My name's Sahib. I'm an emergency trained doctor and an avid football fan. Try to call myself a player, but I would say that over my time I've played plenty of football. I've seen plenty of concussions. I've been on the end of one myself, and as you guys can probably see, it's ramping up. The sort of awareness program around Australia, around the world, is becoming quite important to recognize the effects of concussion. And I think today, if you're going to take anything home today, is just be aware of your surroundings. But most importantly, I'm trying to drive home a message, which is to look after each other. And being teammates goes beyond just passing the ball and kicking the ball and all that. It goes protecting each other. And I'll get into that in a bit more detail about what that means. So how many people here have had a concussion? Few, yeah, good. So those, not good, but those numbers that you see in there, people that have raised their hands, I bet you there's way more that have actually had a concussion and just not been aware of it. And that's the sneaky, sort of insidious side of concussion. And I'm going to get through talking about what a concussion really is. So we always think of concussion as a direct injury to the head or a direct blow to the head, but oftentimes it actually isn't a direct blow. It's an indirect blow sometimes. So we talk about, in medicine, we talk about coup and counter-coup effects, and that just means when your head goes like this and then it jolts back like that. And just that action itself, your brain is sitting in the skull, it's sitting in a cavity there, and when it moves back and forth like that, that itself can create the neurological events that can trigger a concussion. So it's important to know that just because you haven't hit yourself directly or had a direct trauma doesn't mean you don't have a concussion, okay? The other thing I wanted to talk about was that it's transient. So the effects of it, transient just means that it doesn't last forever, okay? Most of the time it doesn't last forever. And in fact, 95% of the time, people recover completely from a concussion. So that's really important to remember. And overwhelmingly, most people won't have any major complications from it, right? And you're probably saying, all right, well, if there's not many complications, it's not something that happens that often, why do we care about it? Well, it's because it's your head, it's your brain, it's the number one thing that you need, isn't it, right? When you get an ankle injury, you hurt your knee there, you're going to recover. And if you don't recover completely, does it affect your quality of life? The question is, does this affect your quality of life if you don't recover completely? And 100% it will, right? And that's why it's so important. I won't really talk too much about sort of the biology of it and all that, the physiology, but essentially what you need to know is there's a disruption of the way your nerves are working, and there's a sort of a circuit break in that moment. And if any of you ever had it, you can't even explain it. There's a fog that comes over your brain, you're confused, but you're almost happy. When I talk to a lot of people that are concussed in Ranver, you'd see the same. They're kind of like dopey, and they can't answer questions, they don't know what's going on. And it can be quite concerning. At the beginning, you're just like, what's wrong with me? I can't even put two sentences together. But after a while, you get quite anxious and you just feel a bit dopey. And that's just that disruption, that the circuits aren't connecting properly. The brain is quite vulnerable. And the thing is, we don't actually have a proper sort of way to diagnose it apart from being a good clinician, and that's a good physio, a good sort of PT, a good doctor, anyone that you've got around there that can recognize the effects. That's the diagnosis. There's no MRI or CT scan that's going to 100% diagnose a concussion. We don't have a blood test for it right now. There's a lot of research in that area, but it's a clinical decision and a clinical diagnosis. Probably the one myth I want to dispel is that you don't need to lose your consciousness for you to have a concussion, all right? So oftentimes you see people that go into a challenge, they don't even hit the ground. They haven't lost their balance or anything like that. At halftime, you go to talk to them and they're just not making sense. So just recognize that concussion doesn't equal loss of consciousness. And Ranveer, feel free to add in if you've had any experience with it otherwise. Does anyone remember this game? Anybody? Do you remember this? I think this was this year, or this past year. It was crazy. So Vertonghen just absolutely got pelted. Like, he took someone's elbow into his nose, was on the ground for minutes, got up and was actually like searching around for where his position was supposed to be. And he was back on the park in 30 seconds. Wasn't cleared, just allowed to play. And some of the backlash that Tottenham got for it afterwards was amazing, because a lot of the community was really upset that they didn't take that opportunity to, show the world how you manage a head injury like that. So the symptoms that you really get, mostly you'll see that confusion, that amnesia, that inability to remember, and a lot of our testing and scoring systems, they go based off that. They say, hey, what was the score at halftime? Who was the last person to score? Who did you play last week? And so when you hear us ask these silly questions, that's what we're trying to do. We're trying to grade how bad is your amnesia? How bad is your confusion? You'll get that blank vacant stare, you'll get loss of consciousness, obviously does happen every now and then. But I think the most important thing to remember is that these symptoms are what put you at a higher risk of injury if we let you back on the park right away, right? So if you're confused, you're not going to go out there and perform well. Your balance is going to be off, your coordination is going to be off, and you're at a higher risk of having another concussion, another head injury. But more importantly, you actually had another risk, which I didn't think about this before, but your coordination's off. You're going to get an ankle injury, a knee injury, a meniscal tear, you're done. So that's really important to remember. That's actually what Vertonghen looked like when they were assessing him. And I just thought it was funny. There's a lot of Twitter feed going around saying that, I don't need to be a medical expert to tell that this guy probably shouldn't return to play.
I'll just jump in here. Me and Bash have been talking for a good 6 months about how concussions managed in football Brisbane, football Queensland, FFA. There's cases like this at the World Game all the time. At the last World Cup, I think it was Algeria, one of the guys was virtually knocked out and clambered to his feet. The medical staff were slapping him to see if he was awake and trying to get him back on the field. That's at the highest level. Concussion's not an easy thing to manage, and you can see all the dramas in NFL, AFL, and at the moment in Australia there's not one big consensus on when this happens, this is how it's got to go down. There's information there, but it's not coming across to our football as good as it needs to be. And cases like that, as a medical person, seriously, concussion is probably the hardest thing I'll deal with out there. No offense to Scotty with your knee, knees are easy. It's either gone or it's not. An ankle, sorry buddy, a couple of weeks, off you go. Concussion is, for me, honestly, it's cooked. I've got to figure it out pretty quickly, try and stop you from going on to have a second head injury. After that, we've got to make sure you're getting pushed into the right things. If we don't manage that first 4 to 6 hours, I've seen him turn very, very quickly. Someone that seems okay, 20 seconds later is profusely vomiting and all over the place. That's how quickly it can deteriorate. And as a medical person, it absolutely shits me that stuff like that does go on. And this is something me and Bash are trying to really put together and spread. It's crazy the long-term effects that can happen. And so,
I think you're absolutely right. So there's no real. It would be nice if it was just from the top level we were told that this is it. And I work for Queensland Rugby, and I got to say Queensland Rugby's probably got it a bit more figured out. And obviously it's because they've had years of head injuries that are a lot more intense than we are. But it's a lot nicer when you all have a protocol from the state level or from the the top governing level. But so that's why we rely right now so much on clubs to take the responsibility and football players take the responsibility. So we're putting it on you for now, but hopefully in the near future we get things protocolized, if you will. Some of the main symptoms, obviously, we talked about headache, dizziness, nausea, vomiting, the ringing in the ears, all that. And then you look at some of the signs, they say concussions are like snowflakes, no two are alike, right? Everybody's very different, so that you can get personality changes, you can just have inappropriate behavior. You can go on YouTube later and have a look.
This one with personality changes, one of the things that comes up every now and then, probably 1 in 5 or 6, is complete out-and-out aggression. That's a big sign for me, something's completely messed up. And if I see it, I've got to quickly figure out, hey, is this guy just pissed off because he's coming off, doesn't want to come off, or is he losing his mind? He's actually got a concussion. You might not think, oh, look, I'm not dizzy, I'm not this, just get off me. It's well, straight away I'm going, red flag, you're out. There's a lot of things, it's not just, oh, I'm not dizzy and lightheaded. There's so many different things I'm looking for in that first 2 minutes that we've got to try and get to the bottom of.
I guess what Ranveer is going off of as well is that it's really tough to diagnose. So it is tough, and that's why we kind of have this air on the side of, you know, you just got to come off. Unless you're really looking sharp and you've had a head, get this all the time. People have a head injury, they come off. I'm fine. They can recite, you know, the alphabet backwards and they're doing great. You just let them back on. That's fine. It's your decision at the end of the day to sort of advise, and I think it's one of those things where it helps if you're honest. It helps if you kind of are truthful with us. And, you know, some people pull themselves off and they say, look, I don't feel right. Something's not right. The fact is, that would be great. Unfortunately, you know, that'd be like asking someone who has lung cancer to just come forward and say, hey, I've got lung cancer. It doesn't work like that, you know. You don't have the perceptibility sometimes to tell us that because of the fact that you're concussed, right? So we need to do our work, we need to do our evaluation, and there's so much at stake for you guys. We get it. You want to stay on the pitch. I've been there. The game's going on, your adrenaline's beating fast, you're losing 2-1, you owe it to your buddies, you want to get in there, you want to make another challenge. It's hard to, where that line is, you know, muddled, and you just make that decision. So we totally understand it. The competition, there's so much online. I suppose the initial things that we sort of expect is just the recognize, remove, and review. That's the sort of the protocol that I like to stick by. So recognizing it is saying, oh, buddy's taking a big hit down there. It's usually the ref, the linesman, the coaches, people that are kind of removed from the physical aspect of the game. They're the ones that can spot it. That guy's not moving quite right. From the TV, we can see it all. It's pretty good. But if you see your buddy, it's really nice if you go up to the ref or, you know, flag it to someone and say, I'm not happy with the way Jimmy's moving. I think we should get him off. So if you guys can, try and do that. That helps us quite a lot. The other thing that I've written up here, and I don't know if any of you have had experience with someone who's on the ground and knocked out and stabilizing their cervical spine, which is quite important. So I put head injuries in the title of this because head injuries and concussion go together. And probably most important thing before you even assess for a concussion is the C-spine. And so that's your cervical spine. And if you've got a fracture in your spine that's unstable, then that's an emergency. We need to get you sorted right away. So look, Ranveer's seeing tons of these head injuries. Call for help early. There's no shame. We get ambulances that go out for people that have locked their cats in the toilet. Okay, so we get ambulances called for stupid things. Any head injury that you're worried about, you'll never get ridiculed for. Just do it. Call for help. That's fine.
Oh, just on this one with recognise, I think in the context of football, you've got to look at it like other sports have trainers on the field. Obviously with us, we don't. So the first person who's there is usually another player. And like it comes up because it comes up every so often. I'm involved with a few different clubs. To be honest, I feel like I'm hearing about concussion each and every week. But there's times where someone will go on if they're allowed to. And I've got 30 seconds sometimes before I'm there, and sometimes the ref doesn't even stop the game, just goes, hey buddy, you alright? It's up to the 4 or 5 players around him that go, no, get him on, just stop, just get him on. Because they might be stumbling to their feet. You've seen clamber. The ref might have had his back to him, he may not have seen that. So if you've seen that as a teammate, that's where you need to go, look, just chill, lie down, just relax, don't worry, no, we'll get someone on. That can make a difference too. Because second head injury is actually, you know, touch under the touch. After the first one, you've got swelling on your brain, so your threshold for another one is actually really, really small. You can take another header, bang, you're out cold. So the second one is what we're really, really trying to avoid. And in football, we are in that unique aspect where your teammates are almost there first. That's where if you hear them going, oh shit, that's killed me, I don't know, I'm not good. Like, just stop. Don't try and go, come on, get up, the last 10 minutes. No way. Just stop it. All right.
And the refs should be on top of it. I think that if I call for a head injury, they have to stop the game.
All we don't want is you running up to a player. Come on, get up, let's go.
No. Remove, safely move the player off the field. That's pretty straightforward. We just need to get him to a quiet place somewhere that's really easy to assess him. And that's probably the easiest part. When it gets more complicated is when there's a C-spine injury, and again, like, you guys don't have to worry about that. That's not your problem. What we do, Look, what we do is we go through that symptom checklist. You know, we go through some of the screening questions that we talked about, those silly questionnaires that some of you have probably been on. We do a bit of a balance test. We do a neurological examination if we're good enough to do that. I think this is something we're trying to get standardized, and with Queensland Rugby, it's great. I've got an iPad there, it's got the app on it, and I just have to go through it. You literally could give that to anyone and they know how to do it, and it's standardized. This is all really going to become important in the next few years, and what's going to be interesting is what your baseline assessments are like. And this is something Matt Ranvier and I are really going to try and work on, which is, like, you might have a very different baseline assessment than you. And so when I go to do a concussion assessment on you guys later, I need to know what your baselines are so I can see how far off it you are, right? And this is something that's interesting. Queensland Rugby a few years ago, what they were doing, the tricky players, they were sneakily changing their baseline assessments, and they were acting dumber on their baseline assessments. And that was so that when they did get a concussion, it didn't seem like they had a concussion. They were just at baseline. So that's this is some sneaky stuff that's done there. We need to have a baseline to be able to assess you really well. It helps a lot. Obviously, some of the scales that we have are good at, deducing if someone needs to go to the hospital. And I'll touch on that because it's quite important. When we tell you we need to go to the hospital, you just got to trust us when we do this. The things that I'm worried about, is an open injury. So if you see a gash and a head injury and a loss of consciousness, you're going to the hospital. Fractured skull, I'm worried about. Any penetrating skull trauma, I got to get you out of there. If you're showing me neurological signs, I'm getting you out of there. If you lost consciousness for more than 1 minute, I got to get you out. Vomiting, persistent vomiting, increased headache after it. Any convulsive movements at all, so that means seizure-like activity. And then if you've had more than one episode of concussive injury in a match, you've got to go. That's just how it works. The other things is if I can't safely monitor you in an area, so if I don't have anybody else that can help me, then I need to get you going as well. So that's a resource management thing as well.
That's probably the big one that we'll see here. 9 o'clock at night, I need you assessed. I'm just physio, I'm not medical. 9 o'clock at night, who's open? You're going to have to go to ED. Get it checked, get it cleared. At the end of the day, it's your life that we're looking after. 2 p.m. in the afternoon, bulk billing doctor's open. Perfect. You can go check in with them first. If they deem it's urgent and necessary, then you go. At 9 o'clock at night, I don't have the luxury of determining whether it's urgent or not. You're just going to have to go.
So we'll just kind of skip ahead to trying to get you back on the park, which is number one thing to remember is that the physios, the medics, everyone, their job isn't to stop you from playing. It's to try and get you to be safe. And at the end of the day, we want you to play. Everybody wants you to play. It's what we would want. So that's what we're after. We want to get you back on the park. We want to get you back at the level that you can perform as best you can, right? So I want your symptoms to resolve. I'd say about 80 to 90% recover within a 7 to 10 day period, right? So that's excellent rate of recovery, right? It means we're doing something right. The other 10%, they need a bit more time usually. And then I'd say there's probably about 1%, 0.5% of people that just shouldn't play. Again, there was an article this week about a young woman with 7 concussions not returning to play ever again because it's just, the repercussions are too high for her, too complicated for her. So what we usually do is we rest, right? The first 48 hours, you get plenty of rest. And that rest is even from your mobile devices. Like, we don't want you on your iPhones too much. I don't want you to play Xbox that much. I don't want you to just not challenge yourself too much. That means not going to a music concert, all other stuff, going out to the pub, that kind of thing. You literally just got to take it easy for 48 hours. And that's you giving yourself the best chance. We're going to do some monitoring after that point. I like to get people back in the clinic pretty early. I like to see how they're going. Some people show me within 4 or 5 days they're doing great. I start to make a plan for them to get back on the pitch. We're going to talk a lot. I think Ranvier throughout the year is going to look at how you can get a graduated return activity. That's slowly introducing you to activity, light exercise, and then you get a bit of moderate, then you get a bit of sport exercise, just getting your heart rate up, keeping that heart rate up and seeing if we can then challenge you with a bit of practice with no contact. So I think you guys can do a lot of, work with a ball and even, just some sprinting, things like that, something low contact. And then eventually, for me, the most important thing is getting you to back to that full contact without fear, right? So we talk about something called anxiety in sport. And a lot of players that have concussion or they have injuries, if anybody's here had an ACL injury, yeah, How scary is it when you go back to play again? You just don't, you're kind of scared to go into a challenge, you're scared to like sprint full on. And some people, that actually stops them from ever reaching the same level again in sport. So the same goes for concussion. A lot of guys don't want to go up for headers. I mean, you think about Raul Jimenez this year, this guy's going to have to wear a rugby cap for the rest of his life. Is he going to go in for that header with David Luiz again? I don't know. I wouldn't. So, you know, that's the plan that we generally make for you. Anything you want to add to that, Randy?
Last point I need is, I need this. I need medical clearance before you're going to come back and play. I don't care if you wait 4 days. I need that.
And what level? Like, what do you just want a GP, or do you want any medical clearance?
GP.
All right.
I've gone through the hospital system. We could touch on it later.
Yeah.
I'll provide resources through the year and stuff. Well, not through the year, through the week. About what services you do have, but
yeah.
I'm just a physio. You need medical clearance. How much more?
No, I'm pretty much ready to wrap it up. I wanted to touch really quickly on little things like factors that can help you in your recovery and things like that. We already talked about it. And there's always factors that are going to make it difficult for you. You know, certain things that we don't like talking about, like depression and you know, mental health disorders, can actually hinder your recovery. So getting on top of those things and being honest with yourself and having a good connection with your GP is going to help you recover in the other aspects of your life, like concussion, etc. Obviously, I don't need to tell you about smoking and drinking, nutrition. You guys know all about that. Yeah, and look, this is, again, harps on a bit about sort of that there's no mandatory period of time. It's not a fixed period of time that we just assign to you and say, you're out 7 days, buddy. No, it's a case by case. Everybody's different. Everybody recovers differently. So we treat it like that, okay? So don't for 1 second think that we're just going to assign that to everyone. I'm not going to, like, I don't want to harp. Everybody seen that Will Smith movie, Concussion? No? So it's a good movie. It's like the Hollywood version of this chat that I'm giving you today. But essentially, you know, there's a lot of studies to show that there's some long-term changes that you need to be careful of. And that's why, you know, we try to give these talks. I'm certainly never going to be the one that says we got to get rid of headers or we got to get rid of headers at youth. In fact, in the UK, there's a lot of push right now for under 15s to not have headers. And personally, that's not something I would be okay with. You know, for my son, when he grows up, I want him to challenge for headers. You know, I want that. So I think that's how you grow and learn. And I think that just being sort of aware of your surroundings, having these kinds of talks, recognizing it early, removing the player, reviewing the player, and just being aware of that is probably the most important thing you can take home from it. Yeah, this is more or less the same thing. All right?
Up to date. Thanks,
cool. And resources-wise, there's heaps on the internet. Ranveer is going to send you through this presentation. I've got resources at the end. And obviously, if you got questions, divert them to Ranveer. And if he needs my help, then I'm happy to help. All right. Anyone who still needs treatment, however, we'll get cracking. Unless